It's normal to worry about your child when they're not feeling well. But the important part is to assess the symptoms and conclude whether they're truly unhealthy, or just a sign of something benign. To dispel your worries, doctors have something to say about the symptoms that your children show. Here at Brightside, we rounded up some of the most common health issues in children and asked doctors what they thought about them. Here's what we found. 1. Vomiting. This is a symptom that happens often, but most of the time has nothing to do with any serious issues. Your child probably either ate too much or they're fighting an infection. Parents tend to panic, but while it's messy and scary, it's not a big problem. Doctors can't do much about it, and they usually recommend that you keep your child hydrated, ensure that they have enough fresh air, and that they have something warm on their belly. 2. Stuffy nose. A stuffy nose is another problem that happens often. Children get around 6 to 8 cases of upper respiratory infections per year on average. However, parents get scared when their baby or a younger child gets a stuffy nose, since it makes their breathing harder, especially at night. Doctors remind us that something like this can be treated easily at home. They recommend using saline drops and a bulb to suck the mucus out. 3. Stomachaches. Stomachaches are a common occurrence too, and usually happen when a child overeats or consumes food that's not good for the stomach. While it may be frightening, it doesn't require a doctor's attention as long as it doesn't stop your kid from acting normally. Some new research states that younger children may say that they have a stomachache when they're actually feeling stressed or anxious, so it would be a good idea to talk to them. 4. Diarrhea. Stomach bugs happen a lot, and diarrhea often comes along with that. It's not fun, and parents and kids both hate it, but it doesn't warrant a visit to the doctor. The important thing, as doctors state, is to keep your children hydrated and on a diet of bland food. That can include bananas, apples, bread, etc. Keep their tummies warm and don't worry, even if it lasts for a few days. As long as they're hydrated, they'll be okay. 5. Headaches. Headaches happen to children as much as they happen to adults. But it's often not a result of something serious. As doctors state, it's usually a consequence of your child forgetting to drink water, jumping too much, or stressing over homework. To help them, make sure that they drink some water and that they have a chance to relax. Doctors always recommend rest when kids have headaches. 6. Fever. Fevers are a sign of something else going on with your child. It could be teething, a stomach bug, or a common cold. The severity of the situation depends on the temperature. If it doesn't go over 102 degrees, you can treat it at home. Doctors say that it's important for parents to remember that fevers are just part of the body's defense system, and it's not serious in most cases. 7. Lethargy. Something that frequently alarms parents is when their children act differently, especially when they're lacking energy. But doctors have a simple explanation for this: your child is probably just growing. When they go through a growth spurt, they can sleep more and feel lazy. As long as they don't behave like that for a prolonged period of time and they still have happy, energetic periods in between, it's completely normal. 8. A bruise. Kids often fall and get bruises. It's a consequence of rough play. Doctors say that it's nothing to worry about as long as it's not extreme. Treatments are not necessary, as bruises often go away in a few days. 9. Sleeping more. Parents are aware that their children need more sleep than they do, however, they're not sure how much more. Doctors claim that toddlers between the ages of 1 and 2 need around 11 to 14 hours of sleep, along with some naps during the day. However, children between the ages of 3 and 5 will sleep for about 13 to 14 hours during the night with no naps during the day. This is what sometimes worries parents, but it's completely normal. 10. Sore throat. A sore throat is painful, but not a cause for worry in most cases. It's usually a symptom of a cold, flu, or a virus, and will pass within 10 days. Warm peppermint tea or a lozenge could help your little one's throat feel better sooner. 11. Cough. Coughs are another example of something that sounds scary but usually isn't serious. It's a common symptom of a virus, and antibiotics aren't necessary. Doctors recommend applying home remedies and avoiding foods and drinks that could put extra stress on the throat. 12. Rash. In babies and younger children, rashes are a common occurrence. Diaper rashes and face rashes are harmless and can be treated at home. According to doctors, you have to make sure that your child's diapers are dry most of the time, that their hands are clean, and that the skin is protected. A visit to the doctor is not necessary unless the rash causes pain. 13. Constipation. Similar to diarrhea and stomachaches, constipation can happen because of something your child ate that didn't agree with them. Doctors recommend drinking fluids and waiting it out for up to 7 days. After that, you should visit your doctor to see if there's anything that could help your child. Have you encountered any of these symptoms in your children? How did you react? Share your stories with us in the comments. Disclaimer, we are certainly not qualified to give any diagnosis. But if these symptoms apply to your child, maybe it's a good idea to see a doctor and get checked.